I'm Dorothy Baker from a rural town with a population of 3,000 in rural backward Alabama. The town is called Abbeville, Alabama. I moved back there to make a difference. I became interested in Patient Advocate Foundation because I saw so much suffering of 3 generations of people in my neighborhood. My grandmother had no health insurance. My great-grandmother had no health insurance. My first family, my mother and father, had no health insurance. They worked in this country. My mother worked 25 years as a laundry worker pressing clothes, and her owner, her boss, never took Social Security out for her. So when she became disabled because of asthma, I took her to the Social Security office, and she had no Social Security because he didn't take out Social Security for her. After 25 years of working in a laundry, my daddy had no insurance because he was a type of man that didn't want to work for nobody. He wanted to have his own business. He had vision, but no money. So he built a cafe and ran a store. And he didn't make enough money to take out health insurance. He didn't make enough money to have Social Security. So both of my parents suffered from a lack of having proper insurance. So coming up in a family like that, I had no other choice but to become an advocate. That was destined, divine destiny, okay? So as I got ready to prepare this speech, I wanted to share that with you. But I also want to tell you a little bit about how I'm blessed in spite of adversity, in spite of the odds of living in an unrepresented, underserved neighborhood. There was some power greater than the definition that I had been classified with as underserved, disadvantaged. There was a power greater than me and the persons that named this community. And that power was the power of, some people call it higher power, but in my community, we call it God, okay? So growing up with a spirit of an extended family where God was the key and the center for my survival and the hope and faith in him that we could survive anything, okay? So I come to you from an extended family community where there was no health insurance as a child for 95% of the people in my neighborhood. So as I walked that journey as a child, growing up in what is called deprivation as a laborer, I didn't feel deprived because I had a power greater than the words. Okay, so I come to you today representing thousands, tens of thousands of senior citizens across America who are suffering because they live on a fixed income and cannot meet medication costs and treatment costs. And they're all, like me, suffering from psychological, emotional, and financial trauma. In my life, because of what I've already communicated to you, we call it historical trauma, okay? So today, I represent, in the state of Alabama, citizens who are living with no Medicaid in the sum of 314,000 uninsured citizens, 75,000 that have no realistic access to health insurance without Medicaid expansion. So I'm here representing today that population and the devastation and the cost of care that goes along with that. Finances little or no money, okay? And the trauma, psychological, emotional trauma associated with that. It's devastating, and I have to get radical. Anybody who administers that, the governor of Alabama and the governor before that, I have to call it what I see. That's called promoting homicidal behavior. Because if you can't prevent people from getting diseases and you can't treat it, that's a genocide. And it's also homicide from administrating. You are practicing homicidal behavior. I need to say that, okay? So I am a victim of asthma as a chronic disease. My mother suffered from asthma. I never had asthma when I was growing up, and I thank God I didn't have it until I was 55. So during my good years when I was young and enjoying life, thank God I didn't suffer from asthma. But at 55, when my mother died, I developed asthma. And sometimes I wonder, is it emotional? Because I used to watch her, and when I was the caretaker for her, I used to look at her and say, oh, I hope I never have this. But I end up with it. So I've come to you today as a care survivor of parents, and I'm coming to you as a social worker and as a patient now with a chronic illness called asthma. And I'm fighting rather than flighting, and I'm not in denial, okay? I am fighting this disease and the conditions around me that does not promote quality care for me as a senior citizen in America. My bills for asthma include steroids that I really wish we could come up with another level of treatment, because we know how dangerous steroids are to our health. And when I first was diagnosed with asthma, I looked at the sheet of the side effects, and I told the nurse, I said, I won't die from asthma, I'll die from the side effects. Okay? So my costs, I just want to share with you, I take 5 medications. The cost of my medicine is $1,700 a month. Symbicort costs $144. The doctor just placed me on Spiriva because he said I'm borderline COPD, but I don't believe him, okay? And that's $317. And total, I totaled it up before I came here. It costs it's $1,700 a month for my medicine and $284 a month for my insurance. I thought that when I went to college 7 years, that's a long time, that I would have enough income when I got ready to retire to take care of all of my needs. But I found out since I retired with a chronic illness that in order for me to be comfortable, I need about $60,000 a year. And I need to be living in a country where we have universal health care. Then I would be comfortable because my health care would be paid for, and I would have enough income to enjoy life. So sometimes I vacillate. Should I move to Sweden? And my family would go crazy and say, I thought, I know Doc was always crazy. She's an old lady and going to Sweden, okay? All right, so this is kind of an overview of how I'm dealing with my chronic illness called asthma. Now, I had something that happened, but I didn't let it devastate me because I rely on the Creator. I lost vision in this eye, but it's not totally gone. So I live in fear of death constantly if you want to look at maybe disease, because you don't know when you have shortness of the breath that you'll get your other breath. So how I compensate for that, I say everybody don't know when they're gonna die. All of us. You cannot have a disease and die. Okay, so I live without fear now. I live a life of purpose and legacy. So everything I do is about purpose and legacy. And I want to inform you all today that Patient Athlete Foundation came in my spirit. This is a movement. I don't know if you know that, but this is a movement. And in the movement, you could talk about your sorrows and your pain, but you got to stay fired up. You got to stay fired up, okay? Because I operate on hope and faith and not despair. It is not important where you stand in life. It's important in which direction you are moving and how you are serving others to meet their needs. So in conclusion of my presentation, there are several thoughts that came to my mind. And one of them was, it's good to lean on God when you're confronting the challenges of chronic illness. You must adopt a spirit of fight rather than flight. And when you have a chronic illness, you're living on a roller coaster. And how I address that is the roller coaster of health treatment is painful when you cannot afford it. So just stick to God and trust Him and enjoy the ride anyway. And at this time, I want to conclude by saying, for all of us that's advocates, we are on a special mission. Sometimes you think it's you that define this mission. It's not you. You are acting out of the Holy Spirit. It's God leading you. And remember this, if you don't stand for something, you'll fall for anything.